Let's begin this morning with that new COVID variant that's quickly put the world on edge. Health officials are warning Omicron looks different from other variants, becoming the dominant strain in South Africa in just a matter of days.
But there is still a lot we don't know about the variant, including how transmissible it is and how serious infections can be. While researchers around the world are working to answer those questions, the World Health Organization says the Omicron variant poses a very high global risk and could lead to a new COVID wave. The first cases were detected in southern Africa last week, and since then, 14 countries have detected Omicron. You're looking at them on your map right now. That includes 7 countries in Europe, 3 countries in Africa, and Canada. World leaders are taking steps that they say are aimed at containing the variant by putting in place travel bans from South Africa. The passengers trying to leave that country are now stranded as borders shut down in response to Omicron. It's too early to tell whether the current vaccines will be effective in protecting against this new variant. Pfizer, Moderna, and Johnson & Johnson have all released statements saying they have begun testing and modifying their vaccines to fight this. But Dr. Anthony Fauci is urging everyone to get vaccinated and boosted immediately.
Even when you have variants of concern, you do well against them. It may not be as good in protecting against initial infection, but it has a very important impact on diminishing the likelihood that you're going to get a severe outcome from it. So this is a clarion call, as far as I'm concerned, of saying, let's put aside all of these differences that we have and say, if you're not vaccinated, get vaccinated. If you're fully vaccinated, get boosted, and get the children vaccinated also.
We have a team of experts in the field to help us break down the very latest COVID variant news from every angle. We want to start this morning with NBC News medical contributor Dr. Kavita Patel and the latest on what we know and also what we don't know yet about this variant. So, Dr. Patel, good morning to you. Hope you had a nice Thanksgiving with your family. What do we know so far about this variant? How concerned should we be?
Yeah, Lindsay, Savannah, good morning. This is something that raises a lot of concern, but really because of a couple of facts. Number one, there are approximately 32 mutations to that red spike protein that give it a lot more kind of opportunity to infect people, attach to people, even, and raises that possibility of what we call immunity escape. But none of that has been proven. So that mutation number alone has alarmed many officials. Fact number two, we've seen, just as you pointed out, Lindsay, an incredible number of people across the globe that seem to have pretty quickly been identified with the Omicron variant. So that speaks to a potential high transmissibility or a high infection rate, even more than Delta. And then I think what's left and what we don't know is really the important pieces. Do our current vaccines work against this? There is really no plausible way that our vaccines are rendered utterly useless against this variant. So the question is, how much of a reduction is there? And is that reduction significant enough to kind of cause more hospitalizations? Right now, the evidence doesn't point to that, but it's still early. And then I think the next question is, what can we do about it? And I think, you heard Dr. Fauci, get vaccinated. I think it's also an emphasis, something to talk about, getting boosted. Boosters can broaden your immunity and potentially kickstart your body into also developing immunity against different variants, including potentially the Omicron variant.
So, Dr. Patel, that's exactly what I want to ask you about next is the shots, getting boosted, getting vaccinated in the first place. So obviously you just laid out all these questions that we still don't have answered. Dr. Fauci also specifically told President Biden it could take up to 2 weeks before we know more about this variant. But in the meantime, everyone is being urged to get vaccinated. And we have heard that these companies are all testing their vaccines against this new variant, potentially modifying them. So explain right now why it makes sense to go get this booster. Is there a potential, though, that the shots could change? Is it going to be a different vaccine and you're going to be boosted with something and then need something else again later? How does this work right now in this kind of in-between time before we know more?
Yeah, great question. So, Savannah, listen, I can't stress this enough. Do not wait for a, quote, modified version of a vaccine simply for the reason that could take time, and we're in a race against time. We're watching how quickly any virus is spreading. By the way, we saw this with Delta. If you recall, I think a number of us were wondering if the current vaccines would work against the Delta variant. Until we had that evidence, there were conversations around tweaking, and all manufacturers said the same thing, that they have the ability, and they do, to quickly, within weeks, Savannah, potentially turn around a new formulation. But that doesn't turn into shots in arms. We have, around any part of the country, shots in arms that are available available for people who are not vaccinated, and then for people who need boosters. And the role of the booster, just to kind of say why you need it now and why you shouldn't wait, the booster really does kickstart your body and tells your body, hey, remember that vaccine we had months ago? We want to prime and increase those antibodies, but we also want your antibodies to be a little bit smarter and develop even more antibodies that could protect you against even more variants. That's critical for now.
All right, Dr. Patel, how much of a role does vaccine inequality play in the spread of this variant?
Yeah, very much so, Lindsay. And if you look at the African nations, that we've got approximately 2 to 10% of African nations vaccinated, that offers just an incredibly large reservoir of opportunity for variants and mutations to develop. So this is just another stark reminder that we're not out of this until we're all vaccinated at as high a rate as possible, putting pressure on many countries like the United States, not just to do travel restrictions, but to also think about how can we amp up opportunity. It's not even the supply, Lindsay. I think it's really about countries' abilities to actually deliver the vaccines into arms.
All right, Dr. Kavita Patel, thanks so much for joining us on this.
Now, as countries around the world react to the Omicron variant, here in the U.S., COVID cases from those other variants are rising in dozens of states as we continue the holiday season. New York has already declared a state of emergency to prepare for the new potential variant, but doctors say they're exhausted and another surge could bring our healthcare system to another halt. Let's now bring in NBC News correspondent Antonia Hilton from Boston and NBC News foreign correspondent Matt Bradley from London for more on this. Good morning to both of you. And Antonia, I'll begin with you. So you're outside of Massachusetts General Hospital. So there's been an uptick there in COVID cases in recent weeks. Those are cases not from the Omicron variant, but from Delta, anything else, just as we've seen sort of the weather get colder. We've watched this happen before. How strained is the healthcare system there, and how are they preparing for the potential of this new variant causing an even bigger spike?
Good morning, Savannah. The health system here in Massachusetts is extremely strained. At MGH behind me here, they're actively treating about 40 COVID patients. But the system isn't just strained by COVID, also strained by elective procedures, treatments, and surgeries that in some cases people put off throughout other phases of this pandemic. And as you mentioned, physicians, nurses, people working at every level of these institutions are experiencing extreme burnout after all of these waves and new variants have already been introduced. I mean, it's been a scramble every time. And what I would describe right now is that people working in this system and around New England, where these cases are taking up, they're bracing for what this new variant could bring. Take a listen to Dr. Raja Ali of MGH's emergency room system here.
If somebody gets the sniffles, rightfully so, we send them home from work and they stay out for a period until they're cleared. If we actually end up with a variant that's more transmissible despite the virus, I'm worried about the impact that will have on our workforce. The bigger issue, though, is that everybody is just really burnt out. The nurses, the doctors, the environmental services staff, everybody is exhausted, and we just don't have enough staff to take care of the patients right now, and that could get worse if we see even more patients.
In anticipation of these kinds of fears, New York City has already announced a state of emergency that is going to allow their hospital systems to turn away or to cancel appointments and procedures that are non-urgent. And right now that has not happened in Massachusetts, but certainly officials in this state and elsewhere are really watching very closely to see what they might have to do to ensure that the kind of crisis he just described there doesn't happen. Savannah?
Absolutely. Now, Matt, let's talk about overseas. So Omicron has already been detected in several European countries, including the Netherlands and Denmark. Are European officials worried they could be facing another wave ahead of winter due to this new variant?
I mean, they're not worried so much about another wave. There's already been another wave, not of Omicron, but of just normal COVID, the Delta variant, other variants. This is already upon us in mainland Europe. Here in Britain, it's a little bit different. There's only 3 cases of Omicron. And, officials here are still very, very worried, even though we're not seeing the same surge in cases. And that's because all of this is precautionary. And that's why today there's going to be a meeting of the government board that deals with immunizations. They're going to be probably deciding that they're going to be lowering the age for the booster shots and encouraging everybody over the age of 18 to get a booster shot, even though Britain has seen quite a lot of vaccination, a very successful vaccination campaign. But Britain is also the rotating president of the G7, and they've called a meeting of G7 nations of health ministers to try to determine what to do about this very troubling new variant. It bears repeating again, there is no really conclusive proof that this is going to make everything worse in terms of the pandemic, in terms of spread, in terms of the lethality of the disease. But there's still so much concern that the G7 is going to be meeting together and trying to decide how to do this next. That's being led by Britain.
Absolutely. Now, Antonia, I think one of the things that we've been talking about here is, where is Omicron at this point? Which countries have detected it? But Dr. Kavita Patel, who was just with us a moment ago, just said over the weekend, it's likely already here. It's spreading. So are doctors taking anything that they learned from the spread of the Delta variant earlier this year to now kind of prepare for Omicron and kind of know that variant is on its way here?
Absolutely, and they're actively having all of those conversations right now. The major lesson learned for doctors in fighting the Delta variant was just how dangerous it is to still have large pockets of unvaccinated people. Even in a state like Massachusetts, which is highly vaccinated, there are still these major pockets. And so long as pockets within the United States or globally are there, that means that new variants like Omicron or others can continue to emerge. And in order to fight back, doctors have realized, really, as this has continued on, now stretching into years, look, that the real critical work is these patient to provider conversations, building trust in communities with low vaccination rates, and really having these one-on-one conversations to understand still at this stage in the pandemic, what are people's fears around getting vaccinated or potentially getting boosted at this stage. Take a listen to Dr. Ali again on the lessons he's learned throughout all of this.
The thing I learned from Delta and the fact that we had a variant that was exceptionally transmissible is that there are still patients who I and other healthcare workers can win over by just taking the time to talk to them. And the fact is that I'm still going to keep trying, and everybody I work with is still going to keep trying. We're not giving up on talking to patients and educating them and helping them with whatever it is that's keeping them from getting vaccinated. I want to make sure that we get as many people vaccinated, and having a transmissible variant just means that we need to try twice as hard to make that happen.
While there's still so much unknown about Omicron, doctors' consistent messaging right now is that the best defense is going to get vaccinated if you have not been vaccinated yet, or if you're still holding out on getting your booster shot, which is now widely available, to please go and do that. They say that this is still going to be our best protection, no matter what we learned about this new variant and when we eventually find out its arrival has happened here in the United States.
And Matt, quickly, you mentioned this urgent meeting of G7 health ministers today. What's the hope to come out of that meeting? What are we hoping that they decide on, or that they're able to talk through?
Well, a coordinated response, especially among the wealthy world. That's what's being represented by the G7. But one thing that the rest of the world is going to be looking at, and this is something that Antonia mentioned with regard to the United States, these pockets of unvaccinated people in the U.S. on the global level. You're seeing that with whole continents. Africa only has about 7% of that continent is vaccinated. That's compared to more than 40% on a global level. It's because of the lack of vaccinations in poorer countries that scientists say that this is giving rise to new variants like Omicron. And that is one of the things that a lot of the world is going to be looking for the G7 to do, to start to spread vaccinations throughout the world beyond just the developed West. Guys?
Matt Bradley and Antonia Hilton, thank you so much.
President Biden is scheduled to speak about this new variant later this morning. Yesterday, he met with Dr. Anthony Fauci and the COVID-19 response team to get an update. And travel restrictions from 8 African countries to the U.S. go into effect today. Let's bring in NBC News correspondent Mike Memoli. So, Mike, good morning. How concerned is the White House about this, and what came out of that meeting yesterday?
Well, Lindsay, to put it bluntly, anything that concerns the American people concerns this White House. You saw before the Thanksgiving holiday, the White House trying to get a little bit more proactive as it relates to some other issues that were concerning the American people, including inflation and supply chain challenges, including the release of fuel from the National Strategic Petroleum Reserve. But we're also now seeing the president before the Thanksgiving holiday talk about how far we'd come in the pandemic, comparing the way Americans were gathered for Thanksgiving holiday in a way that they hadn't been the year before. But now you saw the president returning from his traditional Thanksgiving getaway in Nantucket, meeting immediately with his COVID response team to try to show that they're getting ahead of this situation. And that's what we heard from the president afterwards in the form of a readout from the White House was two things. One, that he heard from Dr. Fauci that we really need to wait for more information. It's going to be at least 2 weeks until we get the really full information about just how transmissible this is and the severity of this, including whether the vaccines hold up. But at this stage, it was the president's readout that we do expect that these vaccines are largely going to be effective against the virus. But clearly, another jolt to the system that for a White House that didn't need another one at this point.
Do you expect that the president will be more warning the people, American people, saying what we know, what we don't know, trying to calm fears, or do you expect also new restrictions will be announced?
Well, what we've seen from this White House is that, as the president himself has said, he is always going to speak straight to the American people about what we know, what we don't know, and about the measures that need to happen here. But we already know that the White House was preparing for a fall surge, a winter surge of the virus, especially given the holidays when people tend to gather, people are inside more. And so what we're likely to hear from the president, according to White House officials, is sort of following the best practices that have already been laid out. Get your booster if you're eligible, if you're able to at this point. Get vaccinated if you hadn't done this at this point. What the White House was already battling was a lot of jurisdictions, including here in D.C., had started lifting things like mask mandates in public places. And so now they're going to be urging Americans to do all the known best practices to try to avoid transmission of any variant here.
And it could be a challenge. It's not just healthcare workers that are burned out, the American public as well. They're tired of the pandemic. Mike, thanks so much.
You got it.
The highly anticipated trial of Ghislaine Maxwell, the former girlfriend of convicted sex offender Jeffrey Epstein, begins today. Maxwell faces 6 criminal counts, including sex trafficking charges for allegedly helping Jeffrey Epstein recruit and abuse underage girls. She's pleaded not guilty to all of those charges, as opening statements are set to begin in just a few hours. NBC News correspondent for investigations Tom Winter is outside the courthouse in New York City. Tom, good morning. So first, just tell us, what can we expect on this first day of the trial, and also remind us of all those charges that Ghislaine Maxwell's facing.
That's right, Savannah. As you can see behind me, people are already starting to get in line, observers, reporters, for this trial today. It's obviously a very different courtroom and a very different setting than from when this whole episode first came up, when Jeffrey Epstein was taken into custody over several years ago with the coronavirus. The courtroom looks more like a hockey penalty box, plexiglass everywhere. But as you said, a whole host of charges that Ghislaine Maxwell faces today. She'll be in court. She's likely already here. They transport her to this courthouse early in the morning. She faces a number of different charges: enticement of a minor to travel for the purposes of illegal sex, conspiracy to transport a minor for sex, sex trafficking conspiracy, sex trafficking of a minor. And Savannah, this is conduct that goes all the way back to 1994 up to 2004. It involves alleged illegal activities that took place at Epstein's property in New Mexico, at his property in Florida, here in New York City, as well as Maxwell's house in London, England.
And Tom, I want to ask you about one of the higher profile allegations here. One of Epstein's victims, Virginia Giuffre, has claimed in a civil lawsuit that Maxwell allegedly trafficked her to Prince Andrew when she was 17. What more do we know about that accusation, and could that come up in this trial?
There's been a lot of speculation about whether or not Virginia Giuffre would come up at trial, whether any of the allegations against Prince Andrew, which she has strenuously denied, will come up at this trial, along with a whole host of other bold-faced names, Savannah. But really, the judge has limited the types of testimony that can come in here, and this has to stay within the 4 corners of the indictment, as prosecutors say. They can only talk about the charges and the conduct that they allege here. Perhaps several other victims may come in to testify to the sex trafficking conspiracy, but nothing involving Virginia Giuffre is included in this indictment, so we don't expect to hear anything about that. Whether or not the prince's name comes up, well, it's a trial and anything can happen, Savannah.
All right, Tom Winter, thank you so much.
The fashion world is mourning the loss of Virgil Abloh. The barrier-breaking fashion designer died yesterday at just 41 years old after a private battle with cancer. He's known for styling stars like Kanye West and Kid Cudi, and he served as the men's artistic director of Louis Vuitton since 2018. And he also founded the streetwear brand Off-White. Since yesterday's announcement, messages from colleagues and admirers have just been pouring in, honoring his work and his legacy in the industry. The executive editor for Teen Vogue writing on Twitter, his contributions to fashion have been shape-shifting in so many ways. Kid Cudi was on SNL just this season, and he actually designed the floral dress that he wore to pay tribute to Kurt Cobain.
Yeah, so many things actually on so many red
So
carpets,
many
so many
iconic
events.
outfits,
Yeah,
you wouldn't even really connect with that name.
And just at 41, and the fact that no one knew that he was battling that. Oh, it's just heartbreaking.
Sad.
Yeah, absolutely. All right, it is time now for a check of your morning news now weather.
All right, Bill Cairns, good morning. How are we looking?
Hey, good Monday morning. Hope you guys had a wonderful holiday weekend. The weather cooperated. I mean, there wasn't many complaints. Vermont got some snow on Saturday, but the skiers loved it. The ski season's off to a great start in northern New England. But it's a little chilly in Florida. I had some complaints about that, but that was it. Everyone pretty much got to their destination. So temperatures this morning, it is still a little brisk. You still need the jackets all the way through Florida. Definitely need the hat, gloves, and jackets in northern portions of Vermont. But much of the country is pretty clear. We have a little bit of light rain in southern portions of Florida. That's about it. There's not a lot of problems. We will see some rain showers in the Pacific Northwest and the northern Rockies. Little bit of light snow possible late today, heading into northern Michigan and Wisconsin, but nothing that's going to cause many issues. And notice the week ahead, there's just not any big storms on the horizon. Even on Wednesday, pretty much nice across the country. It's unusually warm through many areas, but as far as troublesome weather for travel goes, not going to see much of that. And even all the way out through Friday, we're only seeing some light snow in the Great Lakes and northern New England. We finally dried out the end of this week in the Pacific Northwest. And you notice that mild air in the middle of the country finally arrives in the east by the end of the week. So, as we head into December, sometimes it can be active, but that's not this year. These temperatures, the warm air, will even make it to the East Coast this upcoming weekend. So
wow.
I don't have any snow for you. If you want snow, I'm not the person to come to.
Yeah. I am kind of ready for snow. There was a tiny little bit that fell when I was taking my dog out early, I think yesterday morning. Yeah, exactly. All right, Bill, thanks so much. See you in a bit.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.